Today we're going to talk about sexual problems in men. Sexual problems in men. Unfortunately, the only reason for some men to see a doctor. Sex problems can happen in people of all genders. In males, problems might include things like being unable to get or keep an erection most times you have sex. We call this erectile dysfunction, or ED. Having little or no interest in sex, we call this low libido. Ejaculating too soon after sex begins before you're ready to ejaculate, and we call this premature ejaculation. Or being unable to ejaculate at all, even though you can get and keep an erection. But what causes sexual problems in men? Well, there are different reasons why someone may have trouble getting or keeping an erection. It is very important to understand that issues keeping an erection could be related to a condition that keeps the penis from getting enough blood. That's how it works. And not necessarily that you are just not good enough. Things that reduce blood flow to the penis can include your age, just getting older, heart disease, diabetes, high blood pressure, smoking. That is a really very important and big factor in issues related to sexual function. Drinking alcohol or using drugs. And there are other things that can cause sex problems too. Nerve problems or damage. For example, a spinal cord injury or a condition such as multiple sclerosis. Depression, stress, or problems with your partner or the relationship are very common reasons for erectile dysfunction. Certain medications, including medications used to treat depression or heart disease, can lead to that, and that is a frustrating issue because you're trying to fix something, and that might lead you on the direction of having sexual problems. The question many people ask is, should I see a medical professional? And the answer cannot be more blunt to you, yes. Even though there are online programs that offer you the generic blue pill or Viagra easily, it is important that you have an evaluation with your primary care physician or a urologist in order to determine the root cause of your issues. It is not the same to have a 24-year-old otherwise healthy man with erectile dysfunction, for example, as to have a 60-year-old man with diabetes and high blood pressure with the same condition. Treatment may require the use of the blue pill in both cases at the end, but not addressing the underlying issues will just make you a chronic user of a pill that will not treat the other problems. This could be embarrassing for some people to acknowledge before a medical professional. So some people ask, is there anything I can do on my own to improve things? Perhaps. If you're having problems in your current relationship, you can try to improve it with your partner. For example, you can talk to your partner about how to make sex better. You can make an effort to have more fun together by having a regular date night. You can read books or websites about sex. You can also go to counseling, either on your own or with your partner. If you're overweight, losing weight might help improve your sex problems. Getting regular exercise can help too, even if you are not overweight. That certainly will help considerably. How are these sexual problems that we talked about are treated? Well, treatment depends on the cause of the problem and can include things like medications to help you get and keep an erection. Examples of these are medications that include sildenafil, which is the blue pill, or Viagra. There's a couple more called Levitra, which is vardenafil, or Cialis, which is tadalafil. These medications can cause side effects, such as low blood pressure, so you need to be followed by your physician. Some medications for treating sex problems are sold over the internet. However, these are not always safe, and they can even contain harmful ingredients, so be careful with those. Devices to help you get and keep an erection also can be used. These erection devices work in different ways depending on the underlying issue. Some could be implanted surgically into the penis by a surgeon, a specialist. Others work a little bit like a vacuum to try to pull blood into the penis. Sex problems can happen if your body does not make enough testosterone, so replacement of this could be helpful. If your hormones are very low, your medical professional might treat you with testosterone, which can come in the form of a shot, a skin patch, or even tablets. If you're struggling with depression or anxiety, you might need medications and/or counseling. Treatments to delay the ejaculation might be necessary. Sometimes we can prescribe medications to keep you from ejaculating too quickly. Some of these medicines actually are used to treat depression and work very well for this as well. For some, the use of the pause and squeeze method might help. With that method, you stop having sex and press behind the tip of your penis when you feel like you are about to ejaculate. After the feeling goes away, you continue to have sex. Now, it may work and it might not work for some. Sometimes the medicines for treatment of depression can make it hard or even impossible to ejaculate. Although this may seem advantageous to some, it actually could be quite annoying and frustrating. If this happens, a change in the dose or a change in your medication completely might be necessary. So these are my 5 things to remember about sexual problems in men. First, you should not wait to be seen by a doctor until you have sex problems. Having an established relationship with a primary care doctor would make it easier for you to have this kind of conversations if any of these problems were to happen. Second, sexual problems are not your fault. There are underlying medical conditions that in most cases cause them. Third, see a medical professional in person for a complete evaluation. 4, be open with your partner about your concerns. Not doing so would lead to more frustration and poor decisions for your treatment. And finally, remember that there are multiple ways of treating these issues. Just consult with your primary care physician.